Thank you very much, Dr. Levine, for the phenomenal introduction. I just want to welcome everyone to the webinar tonight. And I want to start out by giving you guys the opportunity to give yourself permission to unlock your mind. My whole purpose on this presentation tonight is give you new perspective in how we look at the process of temporization. When you understand the power of a smile, you understand that it's more than just giving a patient confidence. We are unlocking freedom, freedom to explore, freedom to experience, and freedom to empower, not just those that we treat, but those people that are interacting with the patients that we have the honor to serve. And with that being said, for our presentation today, we have a couple of objectives. We want to understand how we apply minimally invasive preparation techniques to maximize saving tooth structure and optimizing our ability to communicate our vision from a patient's chief concern to the insertion of veneers at the end of the process. And we also want to talk about how we approach this process to make sure that our temporaries essentially serve as our blueprints for the final restorations. This is key for those of you that have been involved in cosmetic dentistry or aesthetic restorative dentistry. When a person is coming in, they are a bit apprehensive and they have a vision for themselves. But patients, they don't go to dental school and they have a very difficult time to communicate what it is that they envision in their mind. And it is our job at the initial consultation to translate that vision into something actionable that can manage the patient's expectations and communicate a vision that a patient has for themselves to a laboratory capable of executing on that goal. Here is one of my patients here that you see has a beautiful set of veneers, in my opinion. This is how she presented. Do you think that the dentist was able to execute on her vision for herself? Well, we don't really know that answer. But if we are equipped with tools that essentially allows a patient to test drive teeth, we can use that as the #1 tool to communicate that vision to a lab to bring things to life. And so in dental school, we're taught to look from the inside out. We look at the incisal display from the position of the lip, and we start to use golden ratios or proportions to kind of dictate the proportions that the teeth should be, starting with the central incisors, working our way back. But I want to talk about something in that in facially driven aesthetics, we understand that in nature, no face is symmetrical. And if we respect this rule that all faces have asymmetry and there is inherently some level of beauty in every single face, we can start to adopt new principles of how we see to achieve harmony and balance versus symmetry. And so what I've done over the last, I would say 6 years, is we've adopted a new way to analyze facial structures using vertical and horizontal lines or radial patterns by breaking the face up into 6 different portions and using particular focal points to eliminate what I call aesthetic stress or Summitt-Wright syndrome. And so as you can see, we are transitioning from her initial veneers to a set of provisionals that will be used as the blueprint for the final restorations for the lab. So when you're talking to your lab and you say, I want the teeth to be a little sharper, what does that mean? How can they interpret that? How can we make sure that we manage a patient's expectations that we're going to deliver on what it is that we say that we're going to do? So we like to take an outside-in approach, looking at angles of the face, position of the eyes or the interpupillary line, and movement of the lips in a dynamic way to set the tone for creating facial harmony and balance. So as you can see on the picture on the left, these are beautifully done veneers, but on the left, there's something different about her provisionals. We are able to essentially capture what we call the essence. And the essence is essentially the teeth that belong in a patient's face. And it's that simple. We can use key reference points from how those teeth interact with the lips, how the centrals interact with the laterals, how the laterals interact with the canines in order to create a smile personality that's carried from initial presentation of the teeth into our veneers. So one of the biggest tools that we use in our office is we use a lot of videography to analyze not just phonetics, but the dynamics of the lips and how they move. Whenever we're designing cases, most people use two-dimensional static photographs that gives us a lot of information. And in the last decade, we have had a technological revolution that has allowed us to use digital dentistry, and we can have 3D images, but videography gives us another element of depth to our planning and visualization of these cases. So here we have 4 different facial archetypes. And what I mean by that is that there are only so many facial combinations that exist in nature. And if we can start to develop our own unique library in our brains of which teeth and teeth shapes or teeth combinations belong in each face type, we can kind of understand how to approach each case from a very unique way and give a person something as unique as a thumbprint. And so while all of these cases were treated exactly the same, the teeth look very different because they have very different facial folds, different interpupillary reference points, and all of these cases are very unique. So here, this is a case when the patient had veneers and we were adding volume, and we utilized the temporaries as a tool to understand what happens when all of your initial reference points for capturing essence have been eliminated because the teeth have already been treated. We essentially use facial folds, position of the jawline and jaw structure and lip position to reverse engineer the microaesthetics and what the teeth need to look like. Sometimes there are cultural influences. For example, this case here, where you have an Eastern Asian facial archetype, where you have very flared out distal bellies. It is important to understand some of those nuances when designing teeth. Here again, patients will sometimes come into your office with photographs and saying, hey, doc, I think I want to look like this. But those photographs are about as useless as I don't know what, because every person's face is unique. You don't have the same face, you don't have the same lips, and the teeth are not in the same position. And so when capturing the essence, we also have to deal with space management and facial features, and these will dictate the shapes of the teeth. So here's a case where the patient comes in, she already has absolutely stunning teeth. And we can take these reference points and create a better version of those teeth and analyze how it fits in the face. So once we talk to the lab, the conversation transforms from make them bigger, longer, sharper to copy the temporaries and get creative in terms of how these teeth are layered to accomplish a certain goal. And so one of the reasons why I feel like our cases look really stunning when we work with our ceramist Calvin over at Jason Kim Lab is that if the teeth are in the proper position, we can remove minimum tooth structure and we can allow the actual tooth, the enamel, the tooth structure that is already present to do a ton of the aesthetics. And essentially the only thing we are doing is enamelizing the teeth or adding a very thin layer of veneer that is homogeneous. And so when we're doing these cases, we want to understand how do the temporaries give us adequate information on what to expect in the ceramics. So a lot of debate is centered around, well, how do we prep the teeth? The preps are going to be completely dictated by your vision for the patient. Your temporaries are going to set the tone, and we'll go through really quickly here in the middle of this presentation how we utilize mock-ups in order to get very minimum prep design to allow for uniform thickness of the veneer so that the teeth can look as harmonious as possible and extremely natural, allowing the tooth structure to shine through. So here again, the final vision for the temporaries are going to dictate the prep design. When you're looking at your preps, they should essentially look like mini versions of the temps. This is how you get the best results. Here are the initial teeth here, and you can see if we go back to the previous case, you can see that the preps are essentially mini versions of the teeth. And if you pay particular attention here, this is a line angle in the prep on this canine tooth number 6 that you're going to see is preserved in the shapes of the final temporaries. All of this is done with intention. And I'll go back. You can see the height of contour here in the cervical of the lateral that is carried through so that the lab has adequate room to layer this case. And so really what we're doing is we are looking for predictability. We want to ensure that what the patient expects is what we get in the final result. And so when we insert our cases, we want to cut off half of the provisionals and do a try-in where we measure and see, do the provisionals look like the temporaries? Here are the finals, here are the temps. Here's the full try-in, here's the try-in with water. Pretty consistent. And if we can do this, we can eliminate failing to meet patient expectations, and we can have intentional communication with the lab and set them up for success to do the best job. Here is a case that I did at Aesthetic Advantage a couple of years ago, or a year or two ago, with Calvin. And as you can see, we had to do a little bit of minor tooth movement. The patient had some previous bonding, and we had a set of teeth here in the provisionals that look pretty similar to the final result. And I will take the time to kind of walk you through this case. The temporaries is going to give us the opportunity to work out occlusion, which my partner, Dr. Jay Lerner, is one of the most phenomenal educators that I've ever worked with. He is really good about talking about this in our courses at Aesthetic Connection as well as Aesthetic Advantage. We walk all of our students through exactly how to plan a case from start to finish, taking into consideration not just function and occlusion, but also aesthetics, treatment planning, and soft tissue management. So here you have the patient is kind of flared out. We did a little orthodontics, moved the teeth. He has heavy wear from acid on his teeth. Getting these teeth into better position allows for us to be more minimally invasive. The more tooth structure that we can preserve, the more longevity we're going to have out of our restorations. I have a personal practice philosophy that I want to have most of my restorations in as much enamel as possible. If I have to go through more than the enamel, we decide that orthodontics may be a part of our treatment. I really like coupling a lot of the treatment planning with minor tooth movement to improve the minimally invasive approach so that we can maximize longevity and aesthetics. So here you can see the patient left after we did the ortho and decided to do a little cosmetic bonding. However, the failure in this case is that the patient's expectation wasn't met. He still had a lot left to be desired, even though his teeth look absolutely exquisite. And that's the power of veneers. So here, one thing that I wanted to highlight on this case is that we talked about the temps being the blueprint for the final restorations. If you look at the axial inclination of tooth number 8, this tooth is kind of flared out towards the distal. And the reason why the provisionals give us so much information is that if you cannot have a path of draw when making the temporaries, you know that you're going to have a challenge with the path of draw when inserting this veneer. So before we took the final final impression, we did a little bit of shaving to the distal of this tooth so that the axial inclination was straight. This is how we communicate information about color, giving the ceramics as much information as possible with really good exposed photos, as well as photos that can give them the best opportunity to choose how to layer the case. In my opinion, I like to control the contours, the secondary anatomy, and the texture of the temporaries completely. And I like to collaborate with my ceramists to do the best at what they do and layer the case to give the final result lifelike appearance. So here you can see a set of provisionals where we're able to go in, add secondary anatomy as well as texture and tertiary anatomy. And I want to spend majority of this lecture assuming that many of you have done a provisional on a single tooth or a full arch, or maybe a comprehensive case. But what I want to do is equip you with new tools in order to see how we manipulate line angles, height of contours, and texture in order to create certain illusions that can make teeth look shorter, taller, slimmer, or fatter. So here you could see a digital mock-up that was used. And in our particular workflow, we start with either a wax up, a chairside wax up or a digital wax up, and we make particular modifications so that we can make sure that the temps are blended to the particular patient's face in a unique way. And I'll just kind of show a couple of those cases. Here is a patient in temps. We open the bite. You can see that we use information from the original teeth, like the soft laterals, central dominants, really open embrasures on the mesial of the canines and premolars, and we carried that over to the temporary design. And this is how we're able to capture the essence by customizing the provisionals. So not only do they function properly, but they also fit the patient's facial structure, and they have a nice flow and interaction with the lips. Here's another case where we're able to change the patient's face completely by customizing the provisionals in a way that fit the patient uniquely, taking information from the original teeth, like the central dominants, flat incisal edges on the canines, flat incisal edges on the laterals, open embraces on the canines and premolars, giving her a little bit more volume, adding the illusion that the lower third of the face is now more open. And now this patient goes from someone that looks a little timid, shy, and a little aged because she's lost a little dimension in the lower third of her face. And now her bite is now open back up, bringing a little bit more facial balance to her and breathing life into her. And you can see it when the patient smiles with the eyes. Even when we are doing limited numbers of teeth, we can use these temporaries or provisionals to ensure that everything fits within the face. This is a case where we only did 4 units and a flapless clinical crown lengthening procedure here. Here is another very difficult case where a patient had previous restorations done, and again, these restorations were done very well in London. The doc did a great job of being minimally invasive as they could, but the teeth just did not look like they belonged in her face. And so we're able to customize them in a way that give her a little bit more personality, and they fit her lips and the angles of the jaw and the chin. Here's the initial, temps, finals, and as you can see, all of this information from the provisionals was carried over to the finals. So this patient who felt like she was traumatized from her previous case has an idea of exactly what the teeth are going to look like in the final restorations. And in this industry, I think this is one of the most valuable tools that you can have when doing aesthetic dentistry, is having a peace of mind for the patient, a peace of the mind for the team, and a peace of mind for the lab, that we can ensure that we are meeting the expectations of the patient's original vision for themselves. Well, what happens when space management is a challenge? There is a concept made very popular by an Italian dentist by the name of Maruto Fradiani, and this concept is illusory perception. And this is a concept where we utilize the manipulation of light or the reflection of light with line angles, contours, and shadowing to create an illusion that a tooth is taking up a certain amount of space. And so it would have been ideal here to do some orthodontics, but we could still do this case relatively minimally invasive. She had some ameliogenesis here and underdeveloped enamel, where we're able to do veneers and give her a nice, acceptable result. Although these teeth don't necessarily fit within the golden proportions, when you look at them in the face, they look like they belong. And if you notice, the gum line is a little bit asymmetrical because the lip is asymmetrical. We do that with intention. Here is a case where we take central incisors that are about 10.5 millimeters long. We open the bite, and now these centrals are about 12.2. But they look like the same teeth and the lip was raised. This is another concept of how we're able to use the manipulation of light with line angles and illusory perception to create the illusion that these teeth are well proportioned. But if you look at them, they're actually very long. They're taller than they are wide. So why is this important? Here is an initial photo of a patient. Here is a mock-up of a patient, and here is the customized temporaries. So the first day we did this case, we always bring our patients back 24 hours to analyze the teeth. Why? Because you don't have any workable reference point to analyze incisal edge position when the lips are numb and the patient's been working for 2.5 to 4 hours in a chair and they have a lot of anxiety. They just finished doing a whole bunch. And when we have the opportunity to rest our eyes and bring the patient back, we can take something that looks like this, which I would call an 85 to 95% improvement over her initial smile. We eliminated some of the rotations, we added volume, but when we use these techniques that we're going to talk about a little later in the presentation, we can make something like this look like this, where it is very highly customized, and now we can give this information to the lab using scans or impressions and have them copy the work so that the patient knows what to expect. One of the things that I've learned over the last couple of years is that working on patients who come in with teeth that look this beautiful, they have a certain level of expectation. And no, this technique isn't for everybody, but for people who want to meet the high demands of a very particular patient population, this is the best tool to have that consistent flow of information from what is in her mind to here, to final temps, to insert of the final product. Again, same concept. Here's the mock-up. These middle two photos, temporization here, highly customized. It looks a little bit different, but we're able to give it a certain level of uniqueness and capture the essence of what belongs in her face. We added volume. We have a cant to the lower 1/3 of the face. And if you notice, we did not use interpupillary line as a reference point in order to restore this case, because our goal here was to eliminate the aesthetic stress. If we use the interpupillary line as our reference point, the case would have looked canted when she was in motion. And that is another reason why we use the videos, to make sure that the lip dynamics and the case look fine. Again, another case where we're going from mock-up. This is at the beginning of the appointment. I'm sorry, the end of the appointment on day 1 with the prep and temps. Patient comes back 24 hours. We add customization to these provisionals and we give them a little bit more lifelike properties that fit the patient's face. And if you look, these two teeth look more alike than this and this. Well, one thing that you have to notice when we are trying to capture the essence or the uniqueness of a smile, the original smile charm, you have to understand what it is about a patient's teeth that is a pain point. And so we have to make decisions, personal decisions as dentists. What do we preserve and what do we enhance? And when you get that information and a patient comes in and gives you feedback off of this, you can take her from here to here within a matter of 30 minutes to an hour maximum. So we can also communicate our limitations using the temporaries. Here's a case that many doctors will say, oh man, we're gonna do 2, 4, 8, or 10, but very rarely do we have a case where we can do 6 veneers and make it look good. Well, we try to do that here. The patient comes in at this appointment and says, Doc, can you make the front 6 teeth wider, a lot wider? And we said that absolutely we can. However, we're going to introduce a new stress, and the whole point of coming to do the front 6 teeth was to eliminate the aesthetic stress from having teeth that were different colors. The temporaries can serve as a really good rubric for having that patient understand why, if she wants to have a higher value of color, we may need to do and treat more teeth. So I'm going to kind of breeze through this case because I want to get to the videos at the end. But I want to show something here. This is a set of provisionals. And I did this case in Aesthetic Advantage. And on one side, we have a certain shape of teeth. And on the other side, we have another shape of teeth. And so when you're looking at provisionals, they give us certain information. And I'm going to go back to the preparations. To me, these preparations are quite aggressive. I probably wouldn't prep this case like this again. I would be a lot more minimum, but when you look at the teeth here and you see yellow showing through, there's a decision that needs to be made. I know that if I don't give the lab more preparation, there's going to be show through on the final restorations. Or In this area, the teeth are going to be a little bit more over contoured. Same thing here. If I don't prep more on this lateral, and I already told you that the goal is to maintain our preps in as much enamel as possible. By the time I go through and give more reduction here, this is going to be so over reduced in my personal practice philosophy. And so understanding what to expect from the lab based on your personal practice philosophy is important. And the temporaries are a really good tool to measure that. This is Lux Attempt that we're using here. And when you start to see this show through, we know we are at about a 0.5 thickness of veneer of what we can expect. But here are the final restorations when we did the wet try-in. And to me, this is a pretty good acceptable result that gives us the same concept of what we had before. Now, if I wanted to get skinnier next, I'm gonna have to give the lab more reduction or have the teeth have more contour. But Calvin did a phenomenal job, and the patient's here in her temps versus her finals. So this is a case that I did maybe 5 years ago, and this will give you an idea that when you get a mock-up, a wax-up, or you hand design a wax-up, you take that information and we use it to guide our preparation with reduction burrs. Then we modify these preps. We test it. Here we see that we have a little bit of show through. If we do nothing here, you don't have enough room for ceramic, so you have to have a little bit more reduction here. Here are the final preps. Back then we were doing a back-to-back cord technique. We don't do that anymore. And here we have very thin temporaries. So we know what to expect, that we're gonna have a little bit more contour. And I wanted to include this case because sometimes in the final ceramic, you will see a line that goes right here. If you see this line that goes across on the incisal edge of your preps, you know that the preps are in two planes and you need a little bit more reduction or bevel on the incisal 1/3 to blend the incisal effects on your final restorations. So again, the temporaries are the most important aspect of the process, in my opinion, because not only do they guide the preparations, they also guide the final result. And so there are a couple of different ways, and we don't have to get into it too much, but we have the digital wax up, handmade wax up, and we can also do a handmade wax up using Luxaflow, but the method doesn't necessarily matter. It matters what works in your hands. So here we did clinical crown lengthening implant, flowed a bunch of flowable here, and we utilize pencil markings to mark our primary contours. We cut this back, we take an impression of this chair-made mock-up so that we can make our provisionals that look like this. Now, when it comes to shaping teeth, the key is understanding the rules so you know how to break them. One of the things that I advise all dentists to do if you want to make really good temporaries is look at the morphology of natural teeth. And so we have this concept that we focused on in our practice called believability. And it is not necessarily copying nature, it is borrowing elements of nature like contour, texture, secondary anatomy, translucency, opalescence, and then adapting new principles that don't exist in nature, like brighter colors, to create something that can be believed that it is real. And so everyone is going to have a personal aesthetic philosophy on how they want to design teeth, and beauty is in the eye of the beholder. But the more you understand the nature of natural teeth, the more you're going to be able to break the rules and use illusory perception to make teeth look like they fit in a certain amount of space. So this is one of my favorite natural teeth cases here. These are not veneers, but I look at these teeth often to understand the natural contours so that we can use some of these elements to put them in our temps. So what I want to do is I want to walk you through how we mark our temporaries. So this is a mock-up, and we use these black lines as our transition zones. If you want a wide tooth to look skinnier, you are going to create more space on the outside of these transition zones. If you want this tooth to look wider, you are going to push these transition zones more into the interproximal embrasures. The blue lines represent the light reflective zones. And so this is where, when we put light at 45 degrees, where the tooth is going to reflect. Inside of these blue lines, on the cervical, we have the height of contour of the cervical bulge. Sometimes we use this cervical to increase our lip support, so the cervical contours can also make teeth look longer or shorter. The higher up or the more incisal the cervical bulge is, the shorter the tooth is going to appear, because the zone of reflection is going to be smaller. But there are infinitely many lines or facets that can be drawn on teeth. Teeth have a very good curvature to them. The more curvature to a tooth, the more natural that it looks. The more flat the tooth is, the more like a veneer a tooth looks. And for every person, they're going to have their aesthetic preferences. The deeper the interproximal embrasures are, the more natural teeth look. The more shallow embrasures tend to look more like veneers. So here, our red zones, this is where we have our fossas, and these are the areas that create shadow or depth. The more depth, the less reflective surface you have on the tooth, and the more skinny the tooth is going to look. So you want to get used to looking at your provisionals in multiple angles, because from here you can see that as you go to the posterior, the incisal embrasures become more open. As you go more posterior, you see that the cervical height of contour starts to move. So I also like to look at this view to look at having centrals that sit more dominant on the plane than the lateral. Not all teeth are going to be on the same buccal lingual plane. This gives a case a little bit more depth. Sometimes you want them to all be on the same plane. The more buccal you move a tooth, the wider that tooth becomes. The more lingual you move the tooth, the less space that it takes up, and the shorter the arch length. So one of my favorite views to look at when I'm prepping is this, because you get an opportunity to see how much volume you have in the buccal corridor, and you get to analyze the facial position on the centrals and the laterals, and how the centrals are interacting with the laterals. On the incisal edge, we notice that there are two different line angles. There's a leading edge and a following edge on the palatal. And I find that sometimes when dentists are shaving their temporaries, the incisal edge goes straight across, and there aren't two edges here. So when we do our courses, a lot of the students ask me, well, how are we holding our burrs and what RPMs are we using? One of the biggest keys to doing really good temporaries is understanding how to modulate the handpiece. And I have a couple of quick videos here at the end of this presentation to kind of walk you through how we do that. So when I'm working on the cervical, this is one of the burrs that I use. A very, very skinny burr allows us to get into the brazier. We're going to use these burrs at the highest speed, and we're going to do that wet with very low pressure. Same thing here. When we are trimming on the transition zones, I am angling my burr away from the tooth, and I'll show a video here at the end of how we do that. Okay. So when we're doing our secondary anatomy, these are a couple of points from Cosmodent that I like to use to kind of tone down some of the anatomy. We use these at 10,000 RPMs wet with medium pressure and a lot of copious irrigation. Whenever we are doing the reflective zones and polishing, we're going to use the Cosmodent pink cup, and we're going to use medium pressure and a lot of irrigation. Here are some of the discs that we use. The flexi disc, we use these to trim our incisal edges as well as our interproximal embrasures when we're cutting from the lingual. And when we're doing the tertiary anatomy, we drop our RPMs all the way down to about 400 to 600 RPMs, and we do our pericomata, and we do that at very low pressure, only cutting with the tip of the burr. And so what I want to demonstrate here are some of the materials that we use, the Luxatemp, Luxaflow, and Luxaglaze. I want to kind of walk you through a couple of clips of how we go from initial to temporaries here. And this is her original mock-up. And what I wanted to demonstrate is how we take a mock-up. This side of the mouth is one particular design of modification, and this is another modification where we make these teeth look a lot longer. Over here, we're going to give the teeth a little bit shorter appearance by modulating the height and contour, and I'll show a couple of videos of how we angle our burrs in order to accomplish this. Here are our markings that we put on the teeth for this particular case. And I'll kind of walk you guys through how we trim the facial excess after putting our stent on the teeth.
First thing that I do is, if I'm on the cervical and I'm going in the transition zones, the first thing that I do is I'm going to angle my burr. If I'm on the distal surface, I'm going to angle my burr towards the tooth. And so when you're doing the temporaries, what you'll notice is sometimes there's going to be excess material. So I will take an 016 red strip fine diamond burr, and I'm going to take that burr and I'm going to actually drill on top of the tissue at about 90 degrees. And I'm keeping my burr parallel or perpendicular to the facial surface of the tooth. Now, I don't want to invaginate into this interproximal space because the burr head is way too thick. So I'm just going right on top of the tissue in order to remove the excess. That is the first step that I do when I'm trimming my temporaries, just like this. I'm not concerned with going into interproximal embrasures.
You guys can feel free to put questions in the chat box if you like, and I'll answer them as these videos play.
That's thin. And so I'm going to take my burr, and the first thing I'm going to do is I'm going to turn towards the surface of the tooth that I want to trim. So if I'm on a distal, I'm going to turn my burr towards the mesial. Okay? And I'm going to go in here, and I'm going to trim inside of here. Okay? And then I'm going to take my burr just like this. So watch what you'll see is, once I'm in interproximal space, if you want to have a thin cervical neck, you're going to take this in here and thin everything distal to that transition line that you see here as to not hit it. Once you get in there, you're going to pull the burr up to the buccal. And so as you see, I'm kind of deep here and I'm coming more superficial. So I'll drag my burr to get in an interproximal space. Okay? Now I'll come here. If I'm on the mesial of the lateral, I'm going to turn my burr towards the distal when I'm trimming outside of my transition zones. Okay? In this way. Then I'll come here and I'll actually get into the sulcus of the tooth, and I will continue to trim. Okay? So,
one of the most important aspects of the temporaries is making sure that you have good soft tissue management. And so when seating these cases, you want to eliminate any potential for inflammation. So I feel like the trimming of the margins with a thin flame burr is the most important aspect. So the first thing that I do is essentially make sure that the temps have an exquisite adaptation to the tissue. And so you saw in that first video, we were using a big burr to drill right up on top of the gingiva until it is flushed with the prep. And then we go into the sulcus, pulling the burr away from the tooth so that we don't touch the margin and we trim the excess of the temp.
Side of the transition zones, if I want to thin that up, you'll notice I'll get close to that transition zone without touching it. Okay? Not necessarily worried about the facial because we'll come back to it. And so I'll do this systematically on all of my teeth. And what this is going to do is it's going to deepen my gingival embrasures, create separation, and allow for very nice soft tissue health throughout the healing process of the temporaries. So again, on the distal, I'm turning my burr towards the tooth, towards the mesial with this type of tilt. Okay, same thing here. Now you can be a pusher or a puller. You really become good when you're both. When I'm trimming a lot of surface on a tooth, I like to have a little bit wider of burr. So most people are going to start with essentials, but for me, the canine is the cornerstone of the arch.
So what I mean by the canine being the cornerstone of the arch is that I'm looking at the angle of the jaw on the outside of the face, and I want to make sure that these lines are congruent. And so when I'm looking at this case, I'm always sitting at 12 o'clock so that I can see how much of this distal fossa is showing from the buccal. Same thing here. I don't want any distal fossa showing from the buccal of my premolars and molars, and that will allow for the light reflective zones in these black areas to be very prominent. And we also start to create flat zones here on the facial surfaces. And in the next video, you'll have an opportunity to see how we hold the burr to accomplish that. The whole goal is to manipulate the reflection of light in order to create an illusion of what the teeth look like.
Right, on these teeth. I don't want to see much of this surface on the distal of my canine in this particular case. So what I'm going to do is I'm going to take my canine right at the ridge and I'm going to pull it and leave my mark here. If I want this to be more flat and stand the canine up, I take my burr and I'm going to just pull it and drag. It's all about perspective here. So what we're doing is we're eliminating a little bit of the distal fossa show from the facial.
Now, what you're going to notice is that I'm actually pulling my burr. Remember, I told you you can push or pull. When I'm doing the buccal ridges, I'm looking at the case from 12 o'clock and I'm not wearing any loops because I'm actually not staring where I'm drilling. I'm looking at every single tooth simultaneously as well as the angle of the jaw.
The body and the incisal a little bit more straight. Okay? And it looks like that. So now what I'll do is I'll start to play around with this. If I want this to be wider, what I'm going to do is I'm going to just kind of drill up to my line and give that a little bit more width on my canine. So what you start to notice is you get a sharp ridge here. If you want this to be softer, what you can do is you can just take your burr in this type of motion.
And if you look at this, this is a convex motion where I'm actually going over the tooth in a mesial distal way, kind of taking my burr and going up and down
to create a little bit softer of a curve. Okay, so for here, we mark this line versus this line. The blue is where we want it to be. This is where we are. And so if you want, I'm going to turn my burr away from me in this way. And I'm going to come in here. Okay, slim that up a little bit. So this is what we're looking like. And so for me, if I do that, now I kind of set the tone for my premolars. You can come in here and do it in this way.
So when you're trimming temporaries, understand that you are not trimming individual teeth. You're trimming arches. And the reason I start with the canine, because if I can get the position of the buccal ridge, I know exactly where the height of contours and the buccal ridges need to be placed on the premolars and molars. And then I can work backwards and I can understand how to work the centrals and laterals. There's an algorithm to how we approach each case. And when I'm doing the temporaries, the order in which I trim is always the same, even though the temporaries always look different.
So on the laterals here, if I want this to be less curved, I'm gonna take this on my facial surface, kind of in the long axis of where I want it to be. Make this a little bit more flat in this way, okay?
So as you guys start to do more temporaries, what I like to do is I like to use the surface texture or the movement of water on the tooth to see what the line angles are doing. I'm actually looking at how the light is reflecting on the water as it's coming out of the handpiece. And if you look the position of my handpiece now, we are creating the flat zone in the incisal and the body thirds on the lateral, and we're transposing this zenith in a second going towards the distal.
And this is going to give us a little bit of depth, meaning the laterals are sitting back on their own plane. Now, if I want to make this neck move to the distal, I'm going to remove tooth structure from the mesial of the tooth. So we're going to create the zenith here as the highest point of curvature here on that lateral. And I'm kind of going to keep my burr away from the tooth in this way, kind of giving it this V shape, okay? And that's how we get that going. Now for the centrals, I'm going to angle my burr this way so I can create a little bit of a third plane to kind of tuck the incisor 1/3 back. And we're going to create a little bit of a distal belly. And then we're going to create a flat zone right here so that this could still have a nice dominance. Okay. Now,
the flat zone is going to allow more light to reach the observer's eye.
Okay.
Now, what we're doing here is we are moving the reflective angles or the line angles towards the mesial, making this central incisor look skinnier in the body and the incisal third and giving it a distal belly. So you'll notice these blue lines that are here. We're going to remove tooth structure, and this burr is angled away. So if you're trimming the line angles, the burr is angled away. We're working on the distal. It is going away from the tooth towards the distal.
Okay, we're going to create this here. This will give us,
on the mesial, when trimming on this part of the tooth, the burr is towards the mesial.
slimmer neck and give us a little bit more depth. Now, I like to take this and we can blend the thirds and the cervical region, almost like a paintbrush. As I go into the interproximal, I turn my burr and it just kind of starts to feel natural. Okay? When I'm opening up the embrasures, I'm going to come from the lingual.
I like to trim the embrasures from the lingual because the embrasures are larger on the lingual side, and this is about the skinniest burr from Brasser that I have found. And it works well because it has a very long cutting end and the point stays sharp. I can get about one use per case out of these burrs when trimming tips. I go through a ton of these burrs because I like the tip of the burr to have a nice sharpness so that it cuts efficiently. One thing that people get in trouble is if they're cutting with a dull burr on the tip, it can skip in the bisacrylic material and cause gouges. And so that's when the more teeth you cut, you start to learn that you don't want to hold the handpiece tight. It is essentially a paintbrush that you are allowing to glide over the tooth with as little pressure as possible. And it's important to remain patient when doing this. Your whole goal is to move with intention. Do and execute with the hands what your brain sees.
This way. And I like to come at this angle. Okay. Now, centrals is a little tricky. When you're opening up that central embrasure on the central, it is a little.
So one of the things that we do is after we do our primary contours, we go back and we mark them again with the pencil.
With our initial shaping of the teeth. Now, I've gotten to the point now, I don't do this as much,
Essentially, you're laying the pencil sideways so that you can mark the highest point of contour on the teeth, on the mesial, distal, and the buccal ridges, and cervical had a contour.
Because I can see it, it's not necessary to draw the lines multiple times because it just kind of becomes natural to you. So here, these teeth are a lot more.
Now, if you look at this angle, we're starting to create a nice flow. And this is all done with intention. And I'll kind of
Is the more that it
go a little bit more forward where we're remarking the lines of where we've done some of the work.
How we have shaped up.
And this is what it looks like once we go in as secondary and tertiary anatomy. And you can see the pericomata that are created all with intention to give the lab as much information as possible. And then we take this case and we do the same thing on the other side. And we get something like this, where we can go from mock-up to 2 different versions of the final, so that you can do whatever your mind can think of now that you have a few more tools of understanding how to manipulate the reflection of light. So in our courses, that's a lot of information, a ton to talk about in 45 minutes. We spend 2 full days with our students going over start to finish, how to plan, how to see, how to execute, both lecture format and in the office format. If you guys want an opportunity to kind of peek behind the mask and see what we do in depth, I would encourage you to follow my Instagram at Dr. Brandon Mack, and look out for the announcement of our next date coming in the fall. We also have a couple of other special things planned that I can't wait to announce with you guys. I think it's going to bring a huge value to the people that we work with. I'm always answering as many questions as possible about how we work and what we do. I want to give a huge thank to Marcello, as well as my my top ceramist, Calvin, who is the absolute best at taking a set of provisionals and bring them to life and copy on them. These teeth look extremely real in real life, and sometimes photos don't even do them justice. But I wanted to thank you guys for your time tonight.